These forced birther states are running doctors and other medical professionals out of their states. Labor and delivery hospitals are closing. People that are trying to choose where they are going to do their residency are opting out of going to these states. Women and girls that are looking for colleges are avoiding these states. These forced birther Christo fascist policies are going to have repercussions that are going to be longer lasting than they really think. They think that this is about just like right now and the unborn fetus and all of that. No, it's going to actually start harming people that want to have babies. It's going to harm people that might not even want kids just simply because they are running doctors and potential doctors out of their state. Now, let's talk about Idaho. Idaho termination ban spurs physician exodus, worsening state shortage. Reproductive care doctors are saying goodbye to Idaho since the state's forced birther ban went into effect in August 2022. More than 20% of all OBGYNs in Idaho have left the state, according to the Idaho Coalition for Safe Healthcare, ICSH. Experts say the ban is significantly impacting availability of reproductive health care services, hurting even those who want to be pregnant. This law is disproportionately harming families trying to have children in Idaho, says Susie Killer, CEO of the Idaho Medical Association. We need to protect patients, ensure access to care, and address the workforce shortage. In the first months after the ban went into effect, Keller said that more than 50 OBGYNs left the state, fearing criminal charges and the loss of their medical licenses. But even before the ban, Idaho was short on doctors. The state ranks 45th in the nation for primary care physicians, 49th for all types of physicians, and 50th for general surgeons, according to the Association of American Medical Colleges. There's only around 210 OBGYNs for the state's roughly 947,500 women, one of the lowest doctor to woman ratios in the country. Rural areas face the greatest challenges, ICSH reports, as they struggle to maintain a sufficient healthcare workforce. Nearly 85% of Idaho's OBGYNs are concentrated in the state's seven most populous counties, leaving 22 of Idaho's 44 counties without any at all. The shifting landscape is further adding to the headaches. After the Supreme Court overturned Roe v. Wade in 2022, the Biden administration issued a guideline known as the Emergency Medical Treatment and Labor Act, requiring hospitals that receive Medicare and Medicaid funding to offer emergency small motion care. The Justice Department then sued Idaho, where the law had an exception for pregnant person's life, but not for her health. Idaho ultimately lost that case at the Supreme Court, but although emergency protections were ultimately restored, the changing rules caused difficulties for both patients and providers. There's still a lot of uncertainty, Keller said, and while it's positive to be able to once again treat pregnant women under EMTALA, it doesn't go far enough. And so that's the thing. Even women who want to have babies in Idaho are going to be impacted by these forced birther laws that enacted these fines and jail time. They are making a climate that is not conducive to even want. Why do you even want to go to these states if you have any sense? If you have a medical license, why do you want to go to these states? The current lack of clarity causes stress for both healthcare providers and patients, impacting the quality of care and potentially worsening outcomes, said Dr. Mary Barron-Naga, Assistant Dean at Idaho WWAMI, a multi-state medical education program run through the University of Washington. With a health exception, what we're looking for is not waiting until someone's life is in danger to take action. Nobody really knows how sick we let people get before it is to save the life of the mother, because so many of these women have to be on death's door before some of these states let doctors intervene. Why do women have to be almost dying? It's not just doctors leaving Idaho. As of April 2024, Idaho has seen 3 labor and delivery departments close since the law took effect. In Sandpoint, Bonner General Health ended its obstetrical care in March 2023, citing the state's legal environment as a factor. In Emmett, Valor Health has also shut down its obstetrics program. In Caldwell, West Valley Medical Center closed its labor and delivery and neonatal intensive care units on April 1st, deciding declining birth rates and staffing problems. And at least one more hospital, Steele Memorial Medical Center in Salmon, Idaho, has also paused its labor and delivery services after struggling to find an OBGYN willing to work in rural Idaho. Why would people want to come to Idaho? These forced birthers are going to harm women, even more so than they are doing now. The shortage of healthcare professionals in rural regions is exacerbated by the restrictive laws, Baranaga said, deterring doctors from setting up practices in the state. Hospitals throughout Idaho are having difficulty getting folks to want to come to Idaho and practice, she said. It's affecting the entire pipeline of physicians. Our trainees are seeing the governmental interference into the practice of medicine, and it's causing them to question whether or not they want to practice in Idaho. Idaho lawmakers hope to address the lack of doctors through initiatives like Idaho Launch, a grant program that provides financial support and incentives to doctors in hopes of attracting them. We're incredibly thankful to the physicians that have chosen to stay and continue providing care to expectant mothers, despite the need for legal counsel, said Greg Morrison, vice president of the Idaho Hospital Association. The strict rules and staffing issues take their toll. Rural Idaho clinics and hospitals could use all the help they can get. According to Greg Morrison, the OBGYN shortage is causing women in rural areas to schedule C-sections in advance. They spend the night in a hotel and have their C-section the following day to avoid any kind of last-minute emergency situations. So, ladies in these forced birther states, this could be your state. Now, the whole Project 2025 is a subject that we have talked about on my pages extensively. And what they are doing in some of these Christo-fascist states is already like Project 2025, just on a smaller scale. Like how in Oklahoma, the superintendent said that they need to teach the Bible. If you are agnostic, atheist, if you are any religion other than Christian, how would that impact you and your family if you had to learn about the Bible in school, not in church? This is another reason why I am pushing back against Republicans across the board, all states, this is what they're doing. They are Christo-fascists. They want a theocracy. A new directive from Oklahoma's top education official requires all public schools to teach the Bible and the Ten Commandments. It comes weeks after Louisiana mandated the display of the Ten Commandments in classrooms. Stephanie Sy discussed more with Ryan Walters, the author of the order in Oklahoma State Superintendent of Public Education. Now to Louisiana, which we just touched on. Louisiana governor tells parents against the Ten Commandments in the classroom, tell your children not to look. Okay, so that is where we are. Like I said, they're doing Project 2025 on a smaller scale in these red states. Louisiana Governor Jeff Landry has suggested for parents who don't believe the Ten Commandments should be displayed in public schools throughout the state, tell your children not to look at them. The Republican governor defended the controversial legislation during a news conference announcing how Louisiana intends to fend off a lawsuit that argues it's unconstitutional to hang the Ten Commandments in a state-funded school and college classrooms. Then the bigger impact on the medical community, which I was talking about when I was talking about Idaho. New doctors continue to avoid residencies in states with strict bans. The big picture, in the 2 years since Roe v. Wade was overturned, state-level restrictions are changing the way some medical residents receive training related to abortion and emergency pregnancy care. The numbers of both OBGYNs and emergency medical applicants in 2024 were lower in states with complete bans than in those without, according to analysis from the Association of American Medical Colleges. There are so many things with this Project 2025 and the game plans for Republicans and these Christo fascists, and it's bigger than just the presidential election. But people can only see Kamala Harris and Trump, and it's bigger than them. It's a whole theocracy that these Republicans, these Christo fascists, are trying to push on all of us. It's the bigger picture to look at. Like, comment, and share, y'all.